Welcome to Live with the Eczema Doc, brought to you by Clean Body, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. All right, this is Live with the Eczema Doc, and today I'm really excited to invite Dr. Donald Dennis to our podcast today. And he is an ear, nose, and throat doctor, but he is also the founder of Microbalance Health Products. So, Dr. Dennis, thank you so much for joining us today. And I would love to, first of all, learn about how you went from being an ear, nose, and throat doctor to founding a company that deals with mold and mold products. Tell me a little bit about that.
Well, it was a long journey. And so when you get in private practice, you find out that what you learn to do doesn't work for everyone. And there's a group of people who never get better. And so that happened to me, and had this one patient who had chronic sinusitis. So he had infection and drainage from his nose all the time. It didn't matter what we did. We did surgery and medication, steroids, antibiotics, allergy shots, everything you can think of. We did it, and nothing helped him. And so I started asking why, because I thought all this stuff would work. So it doesn't. One time he came back and he was totally clear. I knew it wasn't anything I did. And so I said, okay, what have you been doing? He said, well, we went to the beach for 2 weeks and I got better. And so then I knew it was environmental. And then we figured out it was fungus, and that was in 1999. And then it was uphill from there, And so all these products had to be made because most of these people that have fungal exposure also have chemical sensitivities.
Can you explain what mycotoxins are and why they might wreak a lot of havoc in the body?
Sure. Well, fungus tries to defend itself by producing toxins called myco. Myco means fungus. So they're called mycotoxins. So it's fungal toxins. And they do that to protect their food source and also to kill things that they can eat. The hyphae produce these chemicals, and they're like microscopic oil droplets that float on top of dust particles. And then they also produce VOCs, volatile organic compounds. And so these are other chemicals. And these are present in the air. Even when you get rid of the fungus, sometimes the mycotoxins are still into the sheetrock and into the wood, and they come out later and still make people sick after they've treated their homes. So in the human, we do a urine test, and the urine, if it's positive for mycotoxins, so you think about it, if it came in through the nose and it ends up in your urine, where is it? It went everywhere. So it's in your whole body, especially the brain. So when you can see it on the CT or MRI scan of the brain, you got to do something about it. And so they'll get people more active with treatment. So we discovered that when people have a positive urine for mycotoxins, all of them have mycotoxins present in their brain. So you have to do a treatment protocol to remove that. And that's not hard to do, but some of them require surgery before you can get it out of the brain, because the spores inside the sinuses, when they get trapped in there with this population group, so one group of people will react to the fungus in their sinuses and swell, and it traps the sinus bacteria or fungus in the sinus, and then they start making more mycotoxins. So they have their own manufacturing facility internally, even after they get their air cleaned. So this is the group of patients that need surgery. But some of the medical treatment can get rid of it too. So probably half of them need surgery, half of them don't. But when you can't get them better medically, they're going to require endoscopic sinus surgery to remove it. The key is you want to stop the reproduction of the manufacturing of the mycotoxins by the fungus, because if you don't stop it, it doesn't matter what you take, you can't keep up with it. You've got to remove the source. So you move the source both in the air and in the sinuses, and that's how you get long-term results.
So we need to make sure we're addressing the environment, but also the internal environment.
That's right.
Inside the body. If somebody had mold in their environment, now they have it inside of their bodies and they're having mycotoxin production, what type of symptoms do these people have? And I know you mentioned chronic sinusitis, but there's often a whole plethora of symptoms, not just sinusitis issues. What are some of the other symptoms someone can experience?
So if you named a system, it would be listed.
Yeah.
Any kind of combination, and everyone's kind of different. The commonality is all of them will have some level of fatigue. They all have that. And we simply say, okay, normal energy level is a 10. Where do you feel like you are now? They'll give you a number. That's pretty accurate too, even if you test them. They sure know what their energy level is. And then you ask them what their cognition level is. And say 0 is you can't do any of it, and 10 is normal. They'll give you a number. So all these people have scores below 10. Most of them are around 5, and some of them are 1 or 2, which is really pitiful. When they have energy level decrease, most of those people, at least over half of them, will have pituitary damage, and they'll be missing thyroid, cortisol, growth hormone, or sex hormones, testosterone, progesterone, estrogen, and some level of dysfunction. So you've got to discover which hormones are missing and replace them to normal levels. We like the levels to be about mid-range. At low normal, they don't do as well.
What have you seen in terms of mold and its association with inflammatory diseases? Our listeners, a lot of them have eczema. So have you seen a correlation here with mold and inflammatory diseases such as eczema?
Well, yeah, that and arthritis, just about everything you can think of, inflammatory systems. And everyone's different. They'll have a different manifestation. So it's not common. But I had a patient, okay, because you see this picture now?
Yes. And for those of you who are listening to this on the podcast, you can go to YouTube and watch the video recording of this so that you can check out these slides. Dr. Dennis is now showing some slides. And Dr. Dennis, you could tell us what we're looking at right now.
Okay, this is the first slide. This particular patient had a heart transplant at age 3 months, and then she had this long-term severe sinusitis and severe dermatitis. And she had 4 different dermatologists, and none of them could really help her. She did all the topical stuff, oral stuff, and this is as good as they got her. We're looking at a picture now. She's got scales and inflammation all over her legs, and she's a 24-year-old female, so that's a problem. So the picture on the left is a CT scan, and this is her eyes up here. Air is black on an x-ray, so all this should be black. So this is all polyps and fungus, and that white thing is a fungus ball inside her sinuses. So we cleaned out all her sinuses and removed all this, and then we put the tissue on an SDA agar mold plate, and this brown stuff here is the tissue we took out of her nose. And in about 4 days, it's got a brown halo around this tissue. So if you assay the tissue and the brown halo for mycotoxins, both of them are positive every time. So this brown halo is mycotoxins coming out of the tissue in her sinuses. So this picture to the upper right is her legs with scales, and they're red all over and look like sores all over her legs. This is about a week after surgery. So if you show this to a dermatologist, they're not going to believe you, because in their world, this can't happen ever. So you never get this kind of result. And the reason is they're not removing the source of the inflammation. They're treating the tissues, but they're not removing the cause. So, and down here, you see the difference in the face. The face is normal here. And this is when she came in, it's all red in her hands and legs. The whole body was like this. So this is my first dramatic introduction into dermatitis. And this is when I knew this fungus is one major cause of eczema. So if you get fungus off the table, you're going to do a good job, a much better job with your skin. And if you ignore it, you're not going to do a good job. So if this patient never got into a better house or fixed her house, it didn't matter what I did, this would never go away. So that's one case. And then the other case is this patient. This is actually kind of, in a one way, more dramatic. You're looking at a big red face here, and a red scaly arm with eczema all over the arm. And then you're looking at, it's clear in the pictures beside it. This is 2 hours after surgery.
Wow.
Think about that.
Wow.
So the lesson here is, what is the most powerful treatment of any illness or dermatologic illness? The most powerful thing you can do is remove the antigen, remove the causative antigen. And when you do that, you get massive quick results. You're taking a knife out of the back instead of giving them a pain pill. You know?
Absolutely. I like that analogy. And for those of you who are listening to this, we are looking at two sets of pictures. One picture, set of pictures is a woman with severe dermatitis, and you're seeing sores even on the skin. And Dr. Dennis, you said, how long was this before this picture where her skin looks completely clear? How long was the time frame for the woman?
A week.
A week. This is amazing. If you guys are listening to this, I would recommend going on YouTube and watching this. These pictures are quite amazing. And now we're looking at a male with severe, skin is red and inflamed. And you said an hour after surgery?
2 hours after surgery.
2 hours after surgery, and all of this redness has come down. So this is quite amazing, Dr. Dennis. Thank you for showing us this. And I think, surgery, it seems like, in my practice, we do this in a more slow progression. We're treating, we're doing sprays and nebulizers and things like that. And I feel more slow progression of healing than potentially surgery, which you're kind of removing that source all at once very quickly.
Yeah, because that's the source of the replication is in the sinuses. And so it goes all over the body and especially the brain. And so we have people who have early Alzheimer's or Parkinson's or just cognitive decline, so they can't do their job. And when we either get them out of the air or get their air remediated properly and then operate on them, most of them have massive improvement in cognition unless they've got permanent damage. And depends on how long they've been sick or not getting help,
So I have a question. I will have patients that I test for mycotoxins, but they don't have any sinus issues. They don't have any sinus related issues. They're not complaining of that at all, but they do have high mycotoxin levels. Are you seeing that the mold might be in other places, not just in the sinuses, or could they be having a mold in the sinuses? They're just not exhibiting symptoms.
Basically, there are 3 genes that aren't related. One is chronic sinusitis, and the second one is chronic sinusitis with nasal polyps. Those 2 are not related. And then the third one is the inability to excrete the toxin. And most of those patients have what's called MTHFR. They can't methylate B12, and so they have difficulty excreting the toxin. That's about 20% of the population. 80% can excrete it pretty well. So you can have 2 people living in the same house. One of them's in a wheelchair, half blind. The other one is not sick at all. And the conclusion is, it can't be the house because I'm not sick. So that's like you're both sitting at the breakfast table eating a bowl of strawberries, and one breaks out in a total body rash, and the other one says, well, it can't be the strawberries because I don't have a rash. It's the same, idea. So they have different genetics, so they can't remove it from their body, so they get sick. That's why they have to fix the air first. Now, it's not good for anybody to breathe this stuff, even if they aren't reacting to it, because it's a toxin. It's also carcinogenic over time. Everyone doesn't get cancer, but some of them do. And so you don't want to be in a moldy situation, even if you have 0 symptoms. So basically, you've got the group, all these 3 are not related. You can have any combination of these 3 genes in your body. So the ones who do not have any sinusitis gene, but can't excrete the toxin, will get the rash. So it's in their sinuses because they breathe it in, but it might not be staying in there because they're not reacting to it. And also we have a group of patients who have really good sinus CT scans, look pretty much normal, but then they've gotten out of their, environment, and their environment's clean and they're doing all the detox things, but they're not getting a lot better. So then in that group, they need surgery even though they don't have anything on the CT scan. So when you operate on them, you always find more than what the CT scan shows. And you take it out and then you assay it for mycotoxins. You find the mycotoxins in high levels in the sinuses, and then you treat them, and you actually irrigate it out and treat the nasal cavity. And then these patients, most of them get better, but they don't have the chronic sinusitis gene. So they don't have obvious sinus disease. So most of those people do not need surgery. They can, do the nasal irrigation and nebulization with an antifungal, and then do all the systemic work and try to get the environment right. That's the key, though. And then you can get them better.
Yeah.
Is that going to work?
Yeah. Yep. That's
not going to work.
Analogy.
Because it's too much volume.
Yeah.
And that's what you got to understand. So if you're really sick, you really need to either fix it or get out of it. You can't take your stuff with you either, because you're just taking the fungus with you.
So do you think that nebulizers work for a major, a percentage of the population? When is it that surgery is needed, or, the nebulizing treatments can work?
Well, that's a really good question too. So there are three things you can do. First thing you do is irrigate, because it came in through your nose. And so you want to irrigate your nose with saline. And the Microbalance website has all this stuff on it in case you want to start doing it. So you irrigate the nose. It's got to be distilled water, not tap water, and it comes with salt packets. So you put the salt package in and shake it up. And then you put citral drops, which is a natural citrus seed extract, about 4 or 5 drops in 6 ounces. And then you irrigate with that. That's the first step. You got to irrigate first. You got to remove the majority of it from your nose. Then you can use a nose spray, which doesn't work as well as a nebulization or a nebulization. You can use citral drops in that. You breathe in through the nose and out through the mouth, nebulizing it, because nebulizers are smaller particles and it gets more places where the air goes. And when they see me, we give them an antifungal, and that, amphotericin or voriconazole works better than just about anything on the planet, those two. Then there's a third part that we've discovered a few years ago, and it's called upside down drops. Now, the key in this is a prescription. You can't do this yourself, but you put the antifungal in a dropper bottle, and you add to that Kenalog. Now, Kenalog is a steroid, but it's a special steroid. It dilates tissues. So if you took Kenalog and you injected it under skin, you'd end up with a divot in your skin, like a divot, a place in your skin where the soft tissue wouldn't grow. So it removes soft tissue just by topically. So it'll dilate the tissues, allowing the antifungal to get into the space. So this is really unique. And if you do this, many people can avoid surgery doing this. But in addition to that, it's got to have xylocaine in there, because the antifungals burn. And so you can feel the burning go between your eyes, where your ethmoid sinuses are, and go back deeper between your eyes. And then in a few seconds, the burning's gone because the xylocaine takes over. But you know where you put it, because you can feel the burn. And then they do that twice a day for a couple of months. And then we repeat the CT scan and see what their symptoms are doing. So if the CT is normal, but the symptoms are still there, they still might need surgery. But most of the time, it would be rare not to have vast improvement on that treatment, unless they're still in it. And that's the most common reason.
But are ENTs generally assessing the CT scan for mold?
No, they'll call mold when it's really obvious. It's a big fungus ball. You can see it in the sinus. They'll know that's mold. But most of the patients I see don't have that. They've got smaller densities in their sinus. So the sinus is supposed to be black, because air is black on an X-ray. So when you see gray stuff in the sinus, that's swollen tissue. And when you see a little white dots in there, fungi secretes calcium salts when it metabolizes food. So that's most of the time that means it's a fungus. It's not 100%, but it's pretty reliable. And then when you operate on those, you do find fungus in just about every one of them. And then you put it on an STI auger plate, and then watch the mycotoxins leach out of the tissue onto the media. And we just showed you a picture of that, the first one. And so that's how you know it's a mycotoxin there, because we've done so many of them now. We know that if it's a brown halo around it, it's mycotoxin. It's nothing else.
Got it.
The key, though, is just getting it out of the body, however you have to do it. Medicine works over half the time, and then the other half, you got to have surgery. But you don't want to have surgery if you're still in it, because it won't work. You're just wasting your time and money.
Right. If the environment still has those mold exposures.
That's right. So you don't get anywhere treating yourself in a fungal environment. Yes, it's good to treat yourself, but you won't get any result because why? You're breathing 3,000 gallons of air a day. That's why. So if you can get yourself first into a safe place and deal with the house later or have it done immediately. And there are other things you can do inside the house that are helpful, but nothing's as helpful as removing the cause and remediating it. But the Israelis invented this thing called a D6 ionizer, and it's about the size of a pack of cigarettes, and it'll remove mold, mycotoxins, VOCs, viruses, and bacteria from the air if you put it on your central system. And we put it in fans with HEPA filters on the back so you can move it around, take it with you. All these things are really helpful in reducing the load, but there's nothing better in removing the cause and the fungus itself and adding this other stuff. But because usually if it's a really bad situation and you have neurological symptoms, you really have to do something environmentally. You can't not do it.
So I know that your company makes natural products for mold to boost immune function, some sinus sprays and things like that. What is the efficacy of those against, the more conventional antifungals that you might use and other conventional medications?
They don't work as well as voriconazole or amphotericin. Now, they still work, but they're not as they're not as strong or as effective, But for the average person, they're effective. They kill viruses, fungus, and bacteria because it's a broad spectrum. And so it is safe. It can't hurt you unless you're allergic to it, and that's pretty rare. So it's helpful to do that if you don't have a prescription. But all those other things are prescriptions. And a lot of people, once they get well, will switch back to the Citra Drops, which is one of our products, because it's a good thing to keep your system clear. Because everybody's going to breathe mold sometime or another. So if you are susceptible to it, you just need to rinse out your nose every day and use the sprays, and then you have a less load all the time.
If somebody has a lot of the symptoms we've discussed, which pretty much any chronic symptom can be indicative of mold, including things like eczema, fatigue, and brain fog, and all of the symptoms we've covered so far. If someone finds themselves with these symptoms, what are the different steps you recommend? First, from testing the environment, and then testing the internal body, which we did mention already, the mycotoxin urine testing. But then also after that, after the testing, and they do find that they're positive, what are the steps they can take in their home, to make sure that they're cleaning all this up? Because it's on our clothes, it's on everything, right? It's on our curtains and our bed sheets and our mattresses. And so what are your recommendations there?
Well, the first thing is most of the time you need some professional help, and it's in the HVAC system. Most of the time, or you got a leak somewhere. You got to find the source of the moisture and fix that. That's number one. And then remove all the contamination. If you do that, then everything else works pretty well. But Microbalance has a number of products that are helpful, but it's not going to be as effective as if you find the cause and fix the cause and remove the cause. Always remember that. You got to get the cause out of there. Yeah, I like our products, but it's not going to help you if you got 6 feet of water in the basement. Don't bother with our products. You just get out and fix your house. So the things that are helpful is the fogger is really powerful because it shoots stuff out in a mist 30 feet, and you don't put it down. You take it around with you and do your whole house, and you're misting it. You're not wetting it. And it's called EC3 Mold Solution, and it's really effective. Then the laundry additive. Almost all washers have a problem with mold, especially the front loaders. If you got a front loader, you got mold, just period. At some point in time, that rubber grommet is going to get black underneath it. It's going to put the mold in your clothes. So we recommend getting a top loader. The Speed Queen TC5 is the best one. So write that down about 10 times, Speed Queen TC5, because that'll save you a bunch of time and anguish.
Yep.
Trying to clean your machine every 5 minutes because it's never ending.
So you're saying people don't necessarily have to get rid of their clothes or their linens. They can
Well, the dry cleanable ones is a different story. You can't, dry cleaning doesn't get it out of the clothes. And sometimes you got to get rid of those clothes. You can try everything, but if you're having a reaction, you just got to get rid of those clothes.
Yeah. I actually have a front loading laundry and it was getting moldy. I could smell it. So I used your laundry additive product and it actually cleared it up. I'm also leaving that door open after I leave. Yeah. So I just leave it open, let it air out because it does hold on to moisture in there. So I did notice that. But yeah, the laundry additive that you guys have, I tried it out and it works pretty well. So I do think that's a good viable option. Okay, great. And so, yeah, so I think, getting professional help is very important. And you said the HVAC, would you need a mold inspector to inspect the HVAC, or is it the people who clean the HVAC system?
It's all over the board. Most of those people have zero training in human health. Even though they may do some things right in the HVAC system, sometimes they don't get the main problem out of there. So all these patients, if you have fiberglass lining inside your duct system or inside your heating and air unit, which are very common, you can't ever get well because fiberglass is a food source for fungus. So it's like cotton candy for fungus. So that stuff's going to be black in a year or two. And then it starts flaking off and coming out. Fiberglass has caused damage. You want to look at that after a while. So the fiberglass causes an immune reaction in the 20% of the population. And so it goes in the lungs and it goes in the sinuses. Now you can have no lung symptoms, which is great, and sinus symptoms, or both. Most people with sinus symptoms do not have lung symptoms. So if you got lung symptoms, you really need to get out of there because breathing is not optional, right? So you're going to have to get your air clean. If you react to fiberglass and it's in your system, it all has to go.
So how would someone find out that they have fiberglass in their ducts? I mean, who would they ask?
You ask all the right questions. So that's really easy to do. So if you look at your heater and you look at the box that sits on top of the heater where all the ducts hook into the system, you'll see all the ducts coming into this box. If you're looking at the box and the outside of the box is sheet metal, that means it's insulated inside the box with fiberglass. So that means that box has to go. Same way with the ducts. If you're looking at metal ducts with no aluminum foil wrapping around the outside of the ducts, that means it's insulated on the inside. So all that has to go or you'll never get better. So you have to replace it. You don't clean it.
Yeah, yeah.
And
you have to replace the entire HVAC system.
Sometimes if you replace the plenum is not the whole system, but the coil box is typically lined with fiberglass. Well, you can take the fiberglass out of the coil box and insulate it from the outside. That's one thing you can do. And then you can change a coil in a system if it's really bad. And so that's easy to do. You just remove it and stick another one in there. And the HVAC system has to be addressed in a moldy house because it's in there 100% of the time. And it depends on what you have to do to get rid of it. Sometimes it's easy because, you got water in the basement, where the leak came from, you fix that. But all that bad air went through your system. So you've got to clean it out thoroughly.
Got it. Well, wow, this is so educational. Thank you so much. Do you have any final resources or tips that you would recommend to anybody who might think they might have a mold problem? Do you have anything to recommend?
I would say if you have neurological symptoms or any chronic illness, arthritis, autoimmune disease, all those kinds of things, I would get a urine mycotoxin level. You can go online. It's called real-time labs, and that's the one I like the best. There are other ones, but this is my favorite one.
Yeah.
So, and you just go online and find that, and you can order a urine kit and just do the urine test. And if it's positive, that means you've got mycotoxins throughout your body and in your brain. So your job then is to find out where is the source. Typically, old cars, 100% of those have fungus. Washing machines, all the front loaders have it. And then the home or the office. And so you can do mold plate testing, and microbalance has mold plate tests on there that you can use So your mold plate tests all that stuff to find out where the location is, where the highest counts are. And that's the simplest way to do it. And then you got to get some competent people to do the work. I have 2 companies that I use to do it. There are other companies that do a good job. I think it's Home Cleanse is the name of one of them.
Okay.
And that's in 50 states. They're pretty good. I've been doing this a long time, and I've rarely ever seen a mold remediation company do a correct job for medical issues. It's almost down to zero. If your microbalance has a lot of articles that are really good, lay articles, and it's got a lot of science in them. So that's a really good place to read. And there's a website called Sinusitis Wellness, and that's got a lot of educational materials. There's no sales on there. It's all education. So
I will link those in the podcast description so that people can access those. Thank you for that information. I had one last question before we head out. So mycotoxins can also be found in food. What are your thoughts around?
Yeah, that's a good question. So that's the grains. It's typically in grains and typically in frozen fruit. So we get the patients off of those 2 things, so we know it's the air. When people freeze fruit, if you buy it frozen, that's the fruit that's kind of starting to get a little bit over-ripened, and they freeze it to save it so they don't have to destroy it. And that's got a higher chance of having fungus. So we don't tell people to get frozen fruit. If you want it frozen, get the new stuff, wash it off, freeze it yourself, And you can put it in the citral drops that we have. You put citral drops in a bowl of water and just soak the stuff in it. It removes everything from the fruit. And it'll last longer too when you do that.
Yeah, I love it. Those are great recommendations. I like those ideas of just buying the fruit fresh and then freezing it yourself.
And the grains, all the grains, are stored in silos, and 100% of silos have fungus. So that's why you want to try to stay away from grains.
Would you also say the nuts and the seeds as well too?
Yeah, it all depends. If they're storing, if they've already shelled them on there and they're stored, they may have a high incidence of fungus. But you could always put some of those nuts on a mold plate and see. That tells you whether they're contaminated or not. It's pretty easy.
Do you think that soaking or sprouting the nuts and the seeds or anything like that could?
I think you could, if you take this nuts or seeds and you have water, a bowl of water, and put about 8-10 citral drops in there. You dump them in there. There is no mycotoxins or anything on those things after about 5 minutes. So it totally obliterates whatever's on top of the seed. So
would they be in the seed though, or just?
That's a good question. I don't know the answer to that. So what you would do, divide the nut, stick it on a mold plate and see.
Yeah. Yeah. That would be an interesting.
Or you could have it tested for mycotoxins. They test, that company has the test for environmental things like dust. So if you wanted something else tested, you vacuum up the dust, you could put the particles of
nuts or seed. Yeah.
No, and just vacuum that up and send that in.
Yeah.
And so that's how you could see if it's contaminated.
So great to know you as a resource. And you're in Georgia, is that correct?
Atlanta.
Atlanta. Okay.
Yeah.
Okay.
About half of my patients come from Georgia.
Okay. Got it. Well, Dr. Dennis, thank you so much. This has been very educational. And I know that the listeners, that all of this information is so wonderful. So thank you. And we will put all the resources that you had mentioned on the links here in the description. And definitely you guys should check out Can you give us where we can find you, Dr. Dennis, your products? What are the websites where we can find you?
The one of them is microbalancehealth.com, Microbalance Health. The other one that's easier for people to remember is sinus5.com, the number 5, sinus5.com.
Okay, great.
That takes you right there.
Perfect. Thank you so much, Dr. Dennis. This, again, been so educational. I really appreciate this conversation that you've had and taking the time out to have this conversation. And we will be putting everything you mentioned, any links or anything, telephone numbers and all that. I'll put that in the description. And anything else you'd like to say before we head out today?
Thank you for the opportunity. And just remember, to get well, you put 3 things in your body: air, water, and food. You got to get them all right. And the most volume that you put in your body is air. So you got to get the air right first for the other 2 to work.
Absolutely. So I think that's what this is about. And we're talking about mold today and how do we get that mold level lower. Thank you so much. And thank you, everyone. And again, all the links will be in the description. And again, thank you, Dr. Dennis, for joining us.
You're welcome. Thank you for having me.
Thank you for joining Live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers or download my free eczema relief guide for quick, practical tips to calm flare-ups and help with your sleep. If you found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.